5 health checkups you should avoid after 70. Number 5 on our list is the bone density scan, DEXA. It sounds harmless, a quick, painless scan that measures whether your bones are at risk. But after 70, almost everyone's density reads low, simply because natural bone loss is part of aging. Too often that result triggers bisphosphonate drugs like alendronate, which come with serious side effects including jawbone necrosis, esophageal irritation, and bizarrely brittle fractures. In one study of 1,200 women over 70, treating mild bone loss with bisphosphonates reduced fractures by just 0.3% over 5 years, while exposing them to digestive problems and odd break patterns. Instead of pills, lifestyle changes, weight-bearing and balance exercises, correcting vitamin D deficiency, and a calcium-rich diet with foods like sardines and leafy greens can cut fractures by more than 20%. Just ask Rose, a 76-year-old piano teacher whose scan showed osteopenia despite no falls or pain. After 3 months on alendronate, she had severe reflux and jaw pain, couldn't play piano, and only got better once she switched to exercise, vitamin D, and diet. Next is the brain MRI for mild memory loss. When seniors feel more forgetful, they fear dementia. So doctors often order an MRI, but in patients 70 to 85, 86% of MRIs show harmless age-related changes, like slight shrinkage or white matter spots. And only 3% find a treatable condition. Yet those benign findings spark panic, more scans, spinal taps, or even biopsies. 12% of patients in one review underwent invasive procedures based on vague MRI results. George, a 74-year-old engineer, had an MRI that showed white matter changes. He panicked, stopped driving and going to church, and only felt himself again after cognitive testing proved his memory was normal, and we focused on sleep, hydration, and brain exercises. Our third dangerous checkup is the cardiac stress test in people without clear symptoms. Designed to spot blocked arteries by monitoring your heart under exercise or medication, it has a false positive rate as high as 40% in seniors. That leads to unnecessary angiograms, stent placements, or bypass surgery, which according to a 2017 JAMA cardiology study provided no survival or quality of life benefit in symptom-free patients, but did increase bleeding, kidney injury from contrast dye, and long hospital stays. Raymond, a 75-year-old former postman, felt only mild hill fatigue, yet underwent a stress test, angiogram, and stent placement. He developed contrast-induced kidney problems and spent 6 days hospitalized, all for fatigue that a little extra hydration and rest would have fixed. Number 2 is routine colonoscopy after 75. The prep requires strong laxatives that can dehydrate you and disturb electrolytes. The sedation can impair brain function and trigger heart rhythm issues, and the scope itself risks bleeding or perforation. In one 2019 study of 1.3 million Medicare patients over 70, for every life saved, there were 10 serious complications, a 10-1 harm to benefit ratio. Even when small polyps are removed, many would never have grown, and the procedure can cause far more harm than leaving them alone. Donna, a healthy 73-year-old baker, had a clean history but underwent a screening colonoscopy that perforated her colon. She spent 9 days in recovery and lost significant strength. The U.S. Preventive Services Task Force recommends stopping routine colonoscopies at 75 and using non-invasive stool-based tests like FIT instead, which catch most cancers without the risks. And the number one worst offender is the annual full-body CT scan, marketed in executive health packages as the ultimate early detection tool. These scans expose you to 10-20 millisieverts of ionizing radiation, each time equivalent to 500 chest x-rays, and modeling suggests up to 5% of all new cancers in the U.S. may be linked to such screening, on par with alcohol consumption. These scans inevitably find harmless nodules or calcifications that prompt more scans, biopsies, and surgeries, often causing more harm than any potential benefit. Marcus, an active 80-year-old martial arts instructor, had a tiny lung nodule found on a full-body CT. Subsequent PT scans and biopsy collapsed part of his lung and landed him in the hospital for 2 months, only to learn the nodule was benign. Leading radiology experts warn that in asymptomatic adults, full-body CT screening provides zero mortality benefit and carries high risks. After 70, the smartest approach is to only do tests when you have clear symptoms. Ask, what will I do with this result? And focus on prevention through staying active, eating well, and getting targeted symptom-driven care. Have you or someone you love ever faced complications from an unnecessary test? Share your experience below. We read and reply to every comment. Disclaimer: the content in this video is provided for informational and educational purposes only and does not constitute medical advice, diagnosis, or treatment. Always consult with your doctor or a qualified healthcare provider before making any decisions related to your health, especially if you are over the age of 60 or have pre-existing conditions. The information presented is based on publicly available research, expert guidelines, and clinical insights, but individual needs and risks may vary. Do not start, stop, or alter any medical procedures or medications without professional guidance. Viewer discretion is advised.